Most health facilities in Sawam Edredri in the eastern region have resorted to the services of water tankers for their daily consumption.
The facilities spend at least 90 Ghana cedis daily for water, even though government has announced that some public institutions are to benefit from free daily water supply.
Ghana has been hit by a major water shortage. Consumers in at least 3 regions, Greater Accra, Western and Eastern regions, have been without water for at least more than a week, with people walking miles in search of potable water. One of the hardest hit areas is in Sawam, in the Eastern region. The shortage in that area is attributed to the low water levels in the Densu River. The water crisis, which is in its 4th week, has forced many residents to resort to fetching water from any available water source for their chores. 2 key institutions, such as health facilities and schools, were short of free water supply from government, but they are yet to benefit. The Nsawam Health Center, Obrejiman and Adredri are just a few of the health facilities struggling to deal with the situation.
The health facilities, some of them have engaged the activities of the water tankers. And so weekly or twice a week they bring them water. And they pay as much as 90 Ghana cedis. And then 2 of the facilities, they were lucky, the MP provided them with polytanks and then give them water as well. And then 2 or 3 of the facilities have mechanized boreholes, so they just pump into the polytank and then use it. But you know, all these, the mechanized borehole, they use electricity, so it's also very costly. And even those who are engaging in the activities of the polytanks, the tanker drivers or whatever, they also need money to buy the water, and it's very expensive.
The Nsawam Health Directorate is also expected to hold an epidemic management meeting as a measure to address a possible outbreak of cholera in the region.
Nsawam Adredri, as a municipality, is known to be cholera zone, and for almost every year we record an outbreak. But notwithstanding that, since there has been this water shortage, at the moment, no, we have not recorded any water-related diseases or any cholera. If I'll be specific, we have not recorded any.
But looking at the trend, looking at how long it's taken government to address the water situation, I've already been told it's entering a month or it's even more than a month. Do you feel of a possible outbreak of cholera within this area?
Yeah, it's possible we can hit with an outbreak. And so as a municipality, like I did indicate earlier on, that in the course of this week, we're meeting with the District Assembly to hold epidemic management meeting to address some of these things. So it is possible we'll be hit with an outbreak. It's possible.
The Nsawam Senior High School, though a beneficiary of the water supply from government, say the situation is impacting on academic works.
Because of that, we have locked all our washrooms, and the students are using the public toilets close to the school. But the unfortunate thing is that this morning I saw that most of them were very late.
So it's
affecting the students indirectly, though they don't reside on campus here. They live close by, some live quite far off. But by the school bus, when I was coming, I had to pick a few to school so that they are not late. But I realized that they didn't have water. Since the problem cropped up, we have had NADMO come to our rescue. NADMO came to supply the school with water. In fact, we got a lot of water in our overhead tank for use, but because of our population, we have about 1,169 students with about 60 teachers, both non-teaching and teaching staff, that use the same facilities. So in a day, the quantum of water that is used is so much. So the water they brought us in 3 days got finished. Fortunately, apart from the water tanker that saved us, they brought us 100 bags of sachet water.
Some residents told Joy News they have received water from NADMO and the assembly in the past few days.
Well, it could be a terrible time for a lot more people, and particularly for food vendors and in Sawam. They have resorted to treating polluted water from streams and ponds to use in preparation of food they sell to the general public.
Residents also say they fear an outbreak of cholera as food vendors continue to cook with unclean water.
For most residents in Nsawam Adwejiri, this is the only source of water for now. Sheila J is one of the few people here at Nsawam operating an eatery. She runs a 24-hour local food joint. She shares how they struggle to get water for the business.
We are suffering about water. Normally we have boreholes here and densu, but the densu is too dirty for us. So we have been buying pure water and boreholes. The business is not going through, and we lost plenty of customers. When they come here, they don't have water.
Has it reduced people coming here?
Yeah.
Why? They don't want to come and eat? Or?
Yeah, because of water. They don't want to come here to eat.
So it has affected your business? People don't
really come here
like they used to?
Yeah, they used to come at first.
Okay, all right. But is there a way that they feel scared about the source of water?
Yeah, they feel scared. How will you get water to cook food? There is a question.
True.
There's a question there.
They are wondering where you get water from.
So if it's with me, I will not go.
You not go?
Yeah.
But so that is the situation you're
Yeah, we are suffering. We are suffering.
Several other food vendors like Bismarck, who also run a fast food joint, shares how far they go in their struggle for water.
We go far away to get some, but sometimes we don't get some.
If you go far away, where exactly do you go to get the water?
Sometimes we go to Amasamai, and sometimes we go to Piabo, the faraway place. Sometimes we didn't get some, and sometimes when you get some, these gallons, when you get some, it's 1 cedi. It's affects me because the water is everything. You use water to do anything here. It's a problem.
So like this morning, before you started cooking and all that, where did you get your water from?
That's why I'm telling you that we go far away, get some. Go far away. Right now, it's problem. It's problem because the water used to cook, used to do anything.
Even the fortunate ones who live around Wafapai joined long queues each morning to get water from this borehole. Delali is the owner of the borehole, which has become the survivor for residents.
I can say it's bad because they come here and queue from 3 a.m. up to 12 midday. Before, at times, most of them don't get and they go back.
School children travel long distance to get water daily. The students say the situation is affecting academic work.
The water situation has become a very great hindrance to most of us in the school because we have to walk very long distances to places in search of water. And it has made most of the students come to school very late, and it is really affecting us.
We, the students of Insa School, is greatly affected by the water problem in Sawam. And because of that, before we can get water and bath and come to school, we have to travel about miles before we can get water to bath and come to school. So we think the government should put in measures to get us adequate supply of water so that we can get enough water and bath.
The effect of the water shortage may be felt even after the situation is resolved, as desperate residents continue to draw water from every access point, which safety is not guaranteed. Matilda Humagan for Joy News in Sawam.
And where blame is supposed to be, I guess the accusation would always be there. And already, the Member of Parliament for the area is blaming government for failing to put to use monies given by the Belgium government to solve the water crisis in his area.
Frank Anadon says government is yet to account for funds meant for the second phase of the water project in his community. He believes the response by government so far has been bad.
So the real problem is that, as geofixers have made us aware, the water table at that area is good enough, so they have to drill boreholes and then they can get water and treat the water for our constituents to benefit from. But fact be told, my investigation has revealed that the Belgian government had given this government 11 million euro to construct that dam and to finish with the water project of the people of Insaum and its environs. Last week, the deputy minister was in parliament, and I asked him specifically, what are they doing about it? And they are saying that they are unable to continue with the second phase of the project because there is no funding. And that's very curious. We need to know what this government did with 11 million euro that the Belgian government had given to us. And why is it that the second stage of the project, which was supposed to ensure that they dam the water, they renovate the old plants and get the new plants, which will be much more efficient?
But what kind of response are you getting from government side?
Well, we've heard that NADMO is also providing water.
But
that has,
like, dealing with the core issue, like you rightly said, about this money that has been given to the government to address the water situation. What exactly is the response you're getting from government?
Well, they've still not been able to make any definite statement in terms of what they've done with 11 million euro and what the deficit is and what has been government contribution towards the project. That they have not been able to tell us. So you, the media, you may have to help us. You have to ask government officials, which are the minister responsible, why is it that the second stage of the project was discontinued? Why is it that they are complaining about money when they have already received 11 million euro? What is happening? Is it that they are not prioritizing the needs of the people of this constituency, or water is not important to them? If we are not careful, you see, my fear is that it could lead to an epidemic.
Exactly.
And that is my fear. This thing is more than 3 weeks. You said 3 weeks. It's almost a month now. I think it's some few days beyond a month. And government's attitude has been lukewarm and lackadaisical. As we speak, still, you just walk through the township and speak to people. Just pick people at random and speak to people, and they will tell you how they feel about government response to this plight.
Acting Chief Executive Officer of the National Health Insurance Authority says his outfit is working closely with members of the Health Insurance Service Providers Association of Ghana, who have reverted to the cash and carry system of treating patients following concerns over unpaid arrears.
The decision by HESPAC follows months of failed promises by the NHIA to offset the amount it owes the service providers. But speaking to Joy News, Acting CEO Nathaniel Otu downplayed the industrial action and said the authority is working closely with HESPAC leadership and stakeholders to end the impasse.
We've done a lot. As a matter of fact, Ghana has scored a lot of firsts in financing healthcare on the continent. We can only keep doing better. We realize our shortfalls, and that's the reason why we started a process of reform, to put things back on track and to make the experience of our population better.
Financial risk protection. Ghana hasn't fared well in this regard. If you say, as we speak, we have 8 out of the 10 regions, HISPAC members embarking on industrial action. What do you say to that?
Well, I think I will talk about the scale of that activity. We have quite a big majority of our providers providing service. But what HISPAC talks about is a general problem that we are dealing with. As a matter of fact, when we have issues, we engage our stakeholders. Last Friday, we talked to HISPAC and we discussed the issues at hand. Some of the issues are squarely within the ambit of the members of HISPAC to resolve, and that will make the experience better. But certainly, the NHIS has changed a little bit the way it works. The controls that we have been doubled to make sure that monies don't go waste when they are paid out. That has caused a little hiccup, and we believe that this week and next week and the week after we'll continue to pay providers so that they'll be able to provide services. But our engagement with HISPAC is that they are not going to cash and carry, and that they'll provide services to our members.
That is what is happening now to a large extent.
Well, I'll tell you what. When providers engage the NHIS, they engage us on contractual basis. And the contractual basis is to provide services per the rules and regulations that exist. If there's a provider who resorts to cash and carry, then they are no more providing NHIS services. A person who provides NHIS services sticks to our tariffs and they stick to our medicines list. They also stick to our procedures for providing claims and also for providing services. Have we had challenges along the line? The answer is yes. We do recognize that. HISPAG and other associations, and they are not the only ones, we keep engaging with all of them. Last Friday, we talked to the pharmaceutical chamber, we talked to the private medical and dental practitioners, we also talked to Christian Health Association of Ghana, we continually talk to Ghana Health Service, and we are working hard to make the situation come back to normal.
Why do you owe so much?
Owing is part of health insurance, whether in Ghana or elsewhere. The issue is the gap of the payments. And what it is that what we have was a technical issue. Currently, it is not because we don't have the money to pay. As I told you, we have changed our systems just a little bit to ensure that systems are efficient and also that we can guarantee that payments that we make are merited to be paid. We'll get over that soon and things will come back to normal.
So how soon should we expect HISPAG members to resume full operations across the country?
They are already operating, and I think my public affairs, my corporate affairs team will give you a joint statement that we have issued to that effect. It is a fact that we had an engagement and they understand the importance of providing services to members of the NHIS, and they are not going to stop.
We have to still remain on health, and doctors and nurses at the One Regional Hospital are protesting the appointment of Dr. Barnabas Ganda as the new medical superintendent of the hospital.
The doctors and nurses believe their preferred candidate, Dr. Anthony Fofier, who is a gynecologist at the hospital, has worked hard enough for that position. Patients who visited the hospital on Monday were refused care. Here's a report by Rafiq Salam.
Looking at the Upper West Regional Hospital from afar, one will think that all is well, but it is not the case when one gets closer. There are notices posted at the doors and entrances of all wards of the hospital. They read, "Dr. Fofier has suffered enough. It is his time. My dear clients, patients, the hospital is shut down. Dr. Ganda is an opportunist, and all nurses go back home, no work until further notice." The notices are about the appointment of a new medical superintendent for the hospital. A couple of weeks ago, head of the gynecology and obstetric unit of the Tamale Teaching Hospital, Dr. Barnabas Ganda, was appointed as the new medical superintendent of the hospital over Dr. Chris Opoku-Fofier, a man nurses and doctors describe here as one of their own. According to the nurses and doctors, Dr. Fofier, for close to a decade, has sacrificed a lot for the hospital and knows the challenges of the hospital better than any new person appointed. They have therefore seen the appointment of Dr. Ganda as the new medical superintendent of the hospital not only unjust but also an insult to hard-working doctors and nurses. The doctors and nurses who are leadless have no option than to lay down their tools. There is no single nurse at the outpatient department to attend to the over dozen of patients here. The patients are abandoned and left either to lie or sit akimbo amidst pain. Two of the patients, a teacher, Fadilata Yusuf, and a student, Dachia Solomon, shared their frustration with Joy News.
When I came, I went and to pick my folder. So after that, they told me that the nurses are not working. I said, why? They told me that and they don't have anything to tell me until they hear something from above. I said, how? So even I called one doctor and then told him about the situation. He said I should just give the phone to any of the nurses. So when I give the phone, the nurses told me that they cannot talk to anybody on my phone. In fact, I'm so hurt. I'm just hurt. So assuming I was in a dying point by now, I'll have been died by now.
On Friday that I came to the hospital, they asked me that I should come here today for the doctor to take me whatever you want. So I will be patient for this hospital. And today I came here. When I came here, I picked the folder. Then after that, they came and said that the daughters are not working. All the places I went through to check that the people should do it and help me what I came here. So here I am standing, what I am standing, the way I'm struggling with that kind of disease, I'm very sorry about that. The daughters, all of them are run. I don't see any of them. So when I came here, I saw the nurses sat down here. Later on, they all ran. Some of them can wear their uniforms and gone away.
While the patients were going through the pain at the OPD and at the wards, management of the hospital were locked in a meeting with the nurses and doctors. Outgoing medical superintendent of the hospital, Dr. William Dodu, appealed to the nurses and doctors to exercise restraint while they look into their concerns. Reporting for Joy News, Rafiq Salam.
Well, the inaccess to a lot more legal materials and reports is expected to be blamed for the many human rights abuses we have in our country.
Though Parliament has passed several laws to govern all aspects of the society, studies show that a large number of the Ghanaian society is unable to access details of these laws. Ranking member on the Legal and Constitutional Affairs of Parliament, Joe Asewusu, says the development undermines the rule of law.
According to the Ghana Legal Information Institute, many Ghanaians are unaware of the rights enshrined in the Constitution and several laws governing the nation. The development has been blamed on non-publication of such laws. The Assembly Press, which is a public institution charged with the responsibility of printing and publishing laws passed by Parliament, is presently unable to publish such materials electronically, thus denying many Ghanaians access to such information. To address the information gap, the Ghana Legal Information Institute, under the auspices of the African Legal Information Institute, was founded. The institute aims at granting free access to laws passed by the country electronically. At a workshop to brainstorm on the best way to make information available to the populace, co-founder of the institute, Obi Amwa, who is also chairman of Parliament's Subsidiary Committee on Legislation, said the move will grant Ghanaians free access to information.
First, people need to have access to the free access. Now, we say we are in a democracy, but if you make laws and people don't even have access to the law, even though it is said that ignorance of the law is no excuse, the non-availability of the law too undermines rule of law.
Participants are drawn from Liberia, Sierra Leone, and other West African countries under the facilitation of the University of Cape Town in South Africa and the University of Ghana Law School. They will, among other things, look at strategic support from stakeholders in the justice sector for input on laws in Ghana, among other topics. Ranking member on the Legal and Constitutional Affairs Committee of Parliament, Joe Asewusu, who opened the program, tells Joy News, an ignorant society is dangerous to the rule of law.
I've known, for example, over the years, that the Ghana Bar Association set up a legal literacy foundation many years ago. It's costly, putting the information together, breaking it down, and disseminating it. How far can you go? But when through the efforts of this group and organization, every legal information, material, judgment, academic discussion is available on the net, then what is left is your desire.
Dean of the University of Ghana Law School, Professor Kofi Kwashiga, is confident the project, if well implemented, will be beneficial to the country's legal system.
Well, so that's it for the news. And as always, we've been encouraging you to get a lot more interactive. And we're glad that you keep sending us a lot more of those messages, especially through our Facebook page or platform, Joy News on TV, which is also linked to our Twitter handle, Joy News on TV. And more so through the number 056-800,000 on WhatsApp. We have a couple of your messages. We start with Michael Amenin, who, as always, if we mention his name, is giving out that very message from the United Kingdom, UK.
But Michael, are you on holidays in Ghana or you're still in the UK?
Good
morning, Mrs. Osabuaje and Mr. Roland Walker.
Thank you. Morning.
The water crisis at Nsawam and other parts of the country that is having a negative impact on every aspect of human life is due to the foresight and the competence that has eluded President Mahama and his government. As the Bible says, because of lack of knowledge, my people perish, and that is what Ghanaians are experiencing under this administration. You, Michael, you find a way to bring it in all the time, but thank you for your message. This one says, good morning, Mama V and Roland. Please help me tell JM that the water situation has become a national problem and we are waiting for his government to fix it. We are also suffering here in Fumbisi, but nobody seems to be aware. It's from Bambakia Summit in Fumbisi sending us that message. Let's see if we can read maybe two more. The needs of the people of Ghana are not being prioritized. More pressing needs are not attended to. Water is a basic need. Our people need water. It's from Robert Avajida, Assemblyman in Kwanta, sending that message. Roland will read maybe the last one or two.
We have this one. Roland and Mamavi, good morning. Here in Thailand, okay, the water that flows from the pipes are used for cleaning and bathing. How do they get their water? From recycling of wastewater, but for drinking, they use reserved osmosis system of draining water. I hope you're not a scientist from the ground. Why can't Ghana follow this method or send experts overseas to learn how to manage water and waste management? Well, I guess we have to tell our many professors that we have around, why can't they copy from Thailand? Because we're just getting this very message from Yakubu Abdullah. Shukran.
Thanks. This one says, nice dress you have. Thank you. Good morning to you guys. Araba Hansen.
Oh, Araba today. And they are giving us this very message from Cape Coast.
This one says,
do you have problems? Yeah, water problems in Cape Coast? Yeah, they do have. We have this one. Good morning, Mr. Roland and my dazzling Mama. You are want. That's from Syed Zamani Tamale. The president has nothing to offer Ghanaians again, if not creating jokes. Come November 7, there shall be a chance for Nana and Baumia, you say, and that's from Sayad.
Charlie, we in politics are one. The government is just collapsing the social interventions introduced by the NPP. Talk about NHIS, school feeding, Metro Mass, and still counting. This must be shown a red card. Ali Kali Kunate in Sandema sending us the message. I love your name, by the way. Okay, let's go down some earlier messages.
We have this one from, I just want to say hi to you guys. That's from Costa Paga, or Costa.
Yeah, Costa is always our friend. He's always sending us a message. Let's go a bit down.
Good morning, Mama V and Roland. Please permit me to use your platform to thank the principal of Nurses and Midwives Training College, Tamale, for the massive development he has brought to the school. Okay, we the students are really grateful, but the pressing issue right now is water in the school and it's affecting us a lot. So please help take up the matter for us, because there's no water flowing through our taps at the area in where the school is situated. Even though he has dug boreholes for the school, there's still no water flowing through them. And please give us your name. I know you're not afraid about, at least once you've commended, you can still make your criticism also known.
Yeah.
All right, so that'll be it for the messages we have for the morning. We're very much grateful that you keep sending out those messages. Please keep them coming. We'll relay a lot more to you in the course of the whole program. But in the meantime, we have to take a break. When we come back, we'll be looking at the newspapers, a lot more headlines. We know the president currently is visiting officially in Iran and conferring with the Iranian president. But also, we have other news as well, all on the front and back pages of the newspapers.
Please do stay.
We'll be right back.